I'm Dr. Jason King. I'm a Yuwadnunga primary care physician currently working in Yarrabah, far North Queensland. Yarrabah is an Aboriginal community of about 3,500 people that's situated an hour's drive southeast of Cairns. As a Yuwadnunga primary care physician, I've had the fantastic privilege of growing up on country. My grandmother's country, which is north of Perth, extends from the town of Moora out to the coast of the West Australian coast there, and she herself was a member of the Stolen Generations, was taken away and sent to the Magumba mission, which is famous from the Rabbit Proof Fence movies. She actually was there at the same time as the young girls in that video. Over the years, I've had the chance as well to work in many other communities around Australia. In the Kimberley, for example, I've worked in communities such as Bidjadanga and Beagle Bay, Ardiloon, and had a chance to look at and to learn from these communities and to see the effects of dispossession of social determinants of health and things such as diabetes, heart disease, lung disease, infectious diseases, and particularly something that's close to my heart literally is rheumatic heart disease, which is a massive problem in Aboriginal and Torres Strait Islanders in Australia. Absolutely doesn't exist in the wider population, and we have third world rates of this, the highest rates in the world, in fact, of rheumatic heart disease. And this is something that I unfortunately suffered as a child from a series of throat infections, went on to have inflammation in my heart and required injections on a monthly basis of antibiotics to help prevent further damage in my heart. And communities around Australia, this is the scourge that cuts lives short, and I think if we understood that the primary, this is a preventable disease that's caused by overcrowding, and this is the kind of thing we see over and over again in communities, that the link between overcrowding or sanitation and access to basic facilities in many communities is very restricted and goes on to affect the lives of children, not only with heart disease, but kidney disease, another massive problem in our communities, a tsunami, in fact, of renal problems in Australia, which we see year on year as a result of simple things like skin infections. And again, traced back to overcrowding and nutrition, in fact. So as we try and raise more awareness of this and make headway into these problems, we need other agencies as well to continue to work to improve this, to invest in communities, to look at where underinvestment occurs and correct that balance so we can help close the gap. When COVID-19 became an issue in early 2020, the community immediately was placed in a lockdown for several months last year. And unlike other lockdowns in other jurisdictions, this was under the Federal Biosecurities Act, which really strongly restricted the movement of residents of Yarrabah in without any cases. So unlike the lockdowns of southeast Queensland and Victoria and New South Wales, for example, we had never had any cases here in Yarrabah, yet the population was incredibly restricted in their movements in and out of the community. This presented really significant challenges for the community because due to the overcrowding here, and 3,500 people currently occupy 350 houses in Yarrabah, the availability of fresh food in the community is a real significant issue here. Food outlets are limited, as well as other essential services being somewhat restricted during that time. That really placed a lot of pressure on the community and the services that are coming into community as well. And we saw a lot of turmoil for the community as a result of that. A lot of anguish because if you can understand the history of Aboriginal peoples in Australia and the effects of federal and state policies, these are seen in last year to be a revisit to those in many respects. And unfortunately, the way that those changes were communicated from federal and state governments and local and regional authorities wasn't particularly well handled, I think. And in communicating those changes and restrictions, the community are then left to try and come up with solutions. Thankfully, through local leadership here in Yarrabah, solutions to those issues, such as food access, essential services and educational services, for example, they all managed to be overcome. However, it took some time to set these things up. When the average Australian can log into Coles online and get their Coles deliveries sorted out, that was a real issue here. We couldn't just simply log on to a website and get Coles to deliver, because it's not part of their usual system, for example, at Woolworths. So these kinds of things that people take for granted in wider Australia were really major issues during last year. As we've progressed beyond that, though, we've seen the changing landscape of how this pandemic is being handled federally and internationally, with increasing lockdowns in Australia as we try and get a handle and to get ahead of flattening the curve initially, and now with the vaccination programs. So again, as the primary care service here in Yarrabah, Gurney, Yarrabah Health Service has been attempting to engage with the community and provide them with access to information about the virus, about the vaccine, and about the best options for them to protect both themselves and their community around them over that time. As the advice from the federal government and the target has changed as well, we as clinicians and as a health service have had to grapple with that information and then provide what we do on a daily basis, which is this kind of translation work where we take health information and then present it through a cultural lens to the community so that they can then make an informed decision, which is part of self-determination, part of personal autonomy. And so this has been major challenges for us in Yarrabah here and for the community to sort of come out ahead. The vaccination program, which here in Yarrabah commenced in March when we received delivery of the AstraZeneca vaccine, started out quite strongly. In the first 10 days, we were regularly seeing over a dozen people a day coming in, which for a community of this size, was seen as a success. Then we saw the changes in advice from the ATAGI around the AstraZeneca vaccine and the changes to access to that vaccine. That then led to almost an immediate drop from the community in terms of their access and their willingness to come and get the vaccine. It then took a considerable amount of time for us to get an alternative access to the Pfizer vaccine and for the ATAGI advice to catch up to that change in the community as well as their initial advice. And I think this is something we see across Australia with parts of the population wishing to have access to a vaccine that is challenging in terms of supply. For the last 6 weeks, we've had access to the Pfizer vaccine. We've seen a steady and gradual increase in people's willingness to come in and first of all, have a chat to us, to yarn with us about their choices, what's right for their health. As you can imagine, with people who have quite complex medical concerns and conditions, they really are keen to make sure they're making the right choice for themselves and their community, and particularly when there are concerns around clotting issues with the AstraZeneca and with things like the myocarditis issues with the Pfizer vaccine. It really shows that people's health literacy and engagement in their health is on the forefront of their minds when they're coming in and actually asking these questions of us. Vaccine hesitancy in communities across Australia has been seen as a real issue at the moment, both in the wider population but also in Aboriginal communities. I think it's important to understand that vaccine hesitancy in Aboriginal communities is potentially coming from a different place to the more mainstream pockets of resistance to vaccine rollouts. Government policy over the years, histories of trauma and removals and stolen generation policies, for example, have often led to a dispossession, a disengagement with health, and a disengagement with education as well as a result of this. And what this leads to is a distrust, I think, in federal policy that comes from a health perspective as well. We've seen the effects of this across Australia in previous years with other vaccine rollouts. We have struggled for many years in some communities to get high rates of flu vaccination, and there's been lots of efforts to try and correct that. And as we see now, the questions that are being asked actually come from a population that's been subjected to policies over the years which is very different, I think, to the way that widespread vaccine hesitancy and the anti-vaccination movement and where those thoughts are seeded from. So we can approach this, I think, from a different angle to try and overcome these challenges, which is to understand and respect that history, to engage with the history in a sense to try and heal those wounds of the past and the history. And then it gives us the opportunity then to have a conversation with the community and to try and reframe that, to look at how they can protect their mob, how they can, protect themselves. And then hopefully, as we progress through this pandemic, we can continue to see low rates of infection in Aboriginal communities across Australia. As a community-controlled health organisation, Gurina Yarrabah operates with a model of care that's really quite broad. It's informed by Indigenous notions of what health represents. And so from a really holistic perspective, we're looking not just at the biopsychosocial aspects of health, which are essential. We're also looking at cultural health, the health of country, spiritual health, kinship health as well, and increasingly elements such as legal health and financial health, which I think are hugely underappreciated when we, as doctors, start to talk to people about their, health concerns. As I said previously, about 80% of our presentations are relatable back to a social determinant of health, things such as housing and education and things of this nature. As that kind of organisation, it's our responsibility to address these concerns, and the community which dictates our day-to-day operations, we have to be answerable to that. So we have sections of our service which are responsible for taking care of the psychological health of the community, to engage with people in terms of their housing as well as education. We have a school attendance program as well as youth programs, elder care programs, men's and women's health specifically, and that within each one of those sections, they really operate through the lens of that broad model of care, which takes into account all those other areas. As I said, I think this is, Aboriginal health and community-controlled health have innovated in this field for over 40 years now, since the first AMS in Redfern in the 70s. And it really is a fantastic blueprint for I think, the rest of Australia to look at how health can be better served. And as we've seen the effect of lockdown in other areas where psychological health is a real concern at the moment, where people's stress levels are rising, access to food in other places with similar problems such as housing issues in council flats in inner city Melbourne and Sydney, for example, and the effect of COVID on those communities. I think if people appreciated health from a broader lens, they would be able to operate with less restriction, I think. So we try and engage with the community through other peak bodies such as the schools, the councils, the legal services in town and the police, for example, as well as elder groups, and then traditional owner groups such as the local PBC and the rangers, which assist us as well in understanding the health of the country around us, so that we can engage with people about their culture, about their connection to country, and we can start to understand where this really intricate web of influences on people's health can be assisted and improved to help get better outcomes for people. My biggest hope is that we can continue to see incredibly low rates of COVID in communities, in Aboriginal communities around Australia. The efforts of community-controlled health organisations, community councils, boards, etc., has really been at the forefront of this fantastic outcome so far in making sure that vulnerable remote communities in particular continue to see zero cases. With overcrowding, for example, the effects of a single case in a community such as Yarrabah would be devastating. We don't yet have the protection of a widespread vaccine acceptance and take-up yet. I hope that by the time we see the end of this pandemic, that we don't see massive cases and the deaths that we would expect from this. Those continued efforts and the support of other agencies such as state and federal government and health departments in this cannot be understated as well. I think they've really responded and respected those efforts for community-controlled health organisations through bodies such as NACHO and here in Queensland, Quake. These bodies help support their member services in advocating for the needs of communities, to respect that local problems need local solutions, and that as an act of self-determination, community-controlled health organisations represent the best option to have positive outcomes. Successive governments have recognised this, I think, and I think that in itself is a fantastic sign. My hope is that that continues, and that funding and support and awareness amongst the broader population continues to grow the role of health organisations on the ground, and that we can help to highlight the need here, as well as to look at the option to improve workforce in this area as well. It's a fantastically rewarding area to be working in, and I think if more people understood the kinds of positive effects and the model of care and how that works, they would see it as being a wonderful place to work, and would help to sort of come on board to continue the hard work of the previous generations.